Welcome to Sports Injury Podcast, episode 15. My name is Josh Ryder. Today we're going to talk about John Wall, the basketball player for the Washington Wizards. I've been following the stories in the news the last few months about his injury status, and what I want to do today is take you through those stories and provide a commentary. I'll put links in the description box to this YouTube video for the news stories. Note that throughout this video we're going to be discussing John Wall's left side. The first article here is from NBCSports.com. The article is dated December 10th, 2018. In this article, the diagnosis of plantar fasciitis is brought up. The next article is from SBNation.com and is dated December 29th, 2018. This article indicates that John Wall plans to have heel surgery. This was surprising to me because surgery for plantar fasciitis and the accompanying heel spur is pretty unusual. Let's take a look at a journal article from the Ochsner Journal from the year 2000 on plantar fascia surgery. The article indicates that most cases of plantar fasciitis respond well to conservative treatment and only 10 to 15% of cases require surgery. On a side note, I did read that the Mets baseball player Cespedes was needing heel spur surgery on both feet. Keep in mind the difference in build between these two gentlemen. I'm going to go ahead and read to you some numbers that I found online. Pull this up here. So Cespedes is 5'10" tall and weighs 220 pounds. So his body mass index is 31.6. John Wall is 6'4", 210 pounds, and his body mass index is therefore 25.6. So big difference there. And we're going to go ahead and go to the literature on this topic. So I'm looking here, I'm pulling this up. There's an article here on plantar fasciitis. It was published in Alternative Medicine Review in 2005. And they describe a multifold increase in odds of getting plantar fasciitis if your BMI is over 30, like we found with Cespedes. The next article is on Forbes.com by Dr. Josh Dines, and let's check the date on that. It was January 4th, 2019. This article indicates that John Wall is actually having surgery related to Haglund's deformity and not the diagnosis of plantar fasciitis/heel spur. This brings up a really important point when we're talking about the phrase heel pain. Haglund's deformity pain occurs on the posterior heel, whereas plantar fasciitis/heel spur pain occurs on the inferior heel. It's important for both medical practitioners and patients to communicate correctly on this. Going back to the article, Dr. Dines brings up a good point on the recovery from this surgery. He mentions that if John Wall has an isolated Haglund's resection surgery, the recovery is going to be faster than if he has the Haglund's resection surgery in conjunction with an Achilles tendon repair surgery. To illustrate this further, let's take a look at one of my sample orthopedic protocols that I had on my loose leaf for Haglund's resection. Let's take a look at something as simple as the weight bearing. According to this protocol, a Haglund's resection in conjunction with Achilles tendon repair surgery is non-weight bearing up until the 6-week post-op point, whereas an isolated Haglund's resection surgery is non-weight bearing only up until the 10-day post-op point. The next article is from bulletsforever.com and is dated January 28, 2019. The article confirms that John Wall had successful surgery in early January. This is where the story gets a little crazy. The next article is from ESPN.com. Now let's check the date on that. It was February 5th, 2019. First of all, from what I can gather, it looks like he had an isolated Haglund's resection. We also learned that John Wall was walking at home without his boot and he had a slip and fall. We also find out that John Wall had some kind of a post-operative infection and had some sort of a procedure to address the infection following the surgery. We then learn that during the procedure for his infection, they find out that his Achilles tendon is torn and will be requiring surgical repair. Let's discuss something here. The prescription of a cam boot in conjunction with a non-weight bearing order, which is not putting the foot down, those orders will be considered normal following a Haglund's resection surgery. The question that will be asked here is why wear the cam boot during a period where you're not weight bearing and you're not putting the foot down? First of all, the boot typically places the foot in a slight plantar flexion bias. That means it's going to point the foot slightly down. This will put the Achilles tendon on slack and consequently decrease the stress on our operated area, which was the calcaneus or heel bone. The other thing that the boot's going to do is protect the area in case there's an accident, and this is where John Wall got into trouble in the case of his slip and fall. Overall, I thought that this case was interesting from an orthopedic perspective, and hopefully John Wall has good success with his Achilles tendon repair surgery.